Welcome, everyone, to the April 18th, 2022 Education Committee and Supplementary Regular Board Meeting of the Lower Merion Board of School Directors. The board believes it's in its best interest and the best interest of the students of the district to hear comments from district residents. An opportunity will be given later in the meeting for public comment, both in person and through the chat feature, which will be read by Ms. Buckman. This meeting is being live streamed and video recorded with sound for public broadcast. All participants joining via Zoom will be muted upon entry. Before we start tonight's meeting, I wanted to do two things. One, you may notice that Ms. Shurak isn't with us tonight. I did want to share that she gave birth to a beautiful baby girl earlier this month, so she will have excused absences for the foreseeable future. And second, I wanted to publicly congratulate Ms. LaPera on Ms. LaPera received the Gertrude E. Kopf Award from the Pennsylvania Association of Educational Office Professionals in recognition of her outstanding service to education. So I just wanted to take a moment and let everyone know what we all know here on the board and in the administration and throughout the district on what a terrific and so important role that you play keeping us all working together. I'm going to turn it over to Dr. Mumin. We had asked him to give us a first update on opportunities for full-day kindergarten.
Thank you so much, President Klein. Welcome, everyone. This evening, I know there has been a discussion in regards to an update in regards to full-day kindergarten. Next week, at our board meeting, we will have a formal presentation. That formal presentation will discuss some of the parameters as class size, looking at the demographics in regards to our 5 to 8 grade configuration. Also, what full-day kindergarten will entail to be fully implemented. Lastly, this will be an ongoing effort where we're going to establish a committee. We're going to have survey results. We're going to push out a lot of surveys and also look at the effectiveness of our K+ program, and we want to address the equity issues. For next week, again, the presentation will be comprehensive. We're going to talk about our actual demographics. We're going to talk about the inception of the idealization around full-day kindergarten, how its inception from the discussions and bring everyone up to date. We'll even talk about the curriculum building pieces and also looking at the implications in regards to class size and staffing. So I wanted to publicly say that we'll have a full comprehensive report next week and begin to let you know what we're looking at in regards to an administration and the future of full-day kindergarten, which I believe is something that's doable. We just have to do it right. We're excited about it, but I want to make sure we bring everyone up to date as, again, the 5 to 8 grade configuration will be going into effect in the fall, and we should be ready to look at full-day kindergarten in the very near future. Thank you.
Thank you, Dr. Mumin. Do you want to, so first on our agenda is a presentation by Ms. Frazier and Dr. Noray.
Dr. Noray's not with us this evening.
Okay.
Yeah.
So it's just me. This is on already. Yeah, great. Good evening. Thank you for the opportunity to present this evening. I am solo this evening, so hopefully I do a dual justice as we go through this. So wanted to share a little bit this evening about our crisis prevention and response protocols and PREPARE in particular. You know, crisis is inevitable, and it's really insufficient to wait to address crisis only in the middle of a crisis situation. And so it's not just about focusing on response and recovery, but thinking about prevention and mitigation. And so that's what PREPARE guides us to do. So this evening, I'm just going to talk a little bit about what is PREPARE, why is it needed, and how do we incorporate it within Lower Merion School District. So again, there's three fundamental characteristics of crisis that you can see up here. Again, when we think of crisis, everyone I'm sure has different things that come to mind, but it really is quite varied. It can be a smaller crisis, it can be much larger. Definitely the unexpected nature of a crisis may make it feel more extreme, definitely lack of control by those that are experiencing it. And really when it happens with little to no warning, the impact of that crisis can be more significant. And really, again, as we go through this, we think about crisis as really a range, and it ranges from the level of impact, the number of people that are involved and impacted by it, and also the extent of the crisis itself. And so these are often times where important decisions need to be made, and we need to be thoughtful about how we support our students, our staff, and our community at large. PREPARE is a school crisis prevention and intervention training curriculum, and it really is designed specifically for school districts to provide training for personnel in crisis preparedness. It was developed by the National Association of School Psychologists, and it really provides us with evidence-based resources and consultation to be able to deal with crisis. Through PREPARE, they've incorporated basic principles articulated by the U.S. Departments of Education and Homeland Security, as well as the National Incident Management System. It's actually implemented in school districts across all 50 states and in multiple countries. And again, it's proven to be highly effective for schools that are committed to improving and strengthening their school safety and crisis management capabilities. And when team members go through the training, and this was reported by NASP, but I can just also say personally from our teams going through it, they report a positive effect just in terms of the attitude and towards their ability to be able to participate on school crisis response teams, and an increase in knowledge about being able to face those crises. Again, unfortunately, crisis situations are inevitable, but the PREPARE model provides us with a school crisis management that is designed by educators who all had experience working in crisis response within the educational system, who had that firsthand training. So it's designed by educators for educators, and the unique things that we have to think about in the school setting. Highlights definitely school climate and safety, and how important we all know school climate and safety are as it's linked to academic achievement when we think about the whole child. So why do schools need this training? Again, good crisis planning and preparation really does help to mitigate the impact of the event of a crisis. Again, we can make efforts to prevent, we can definitely make efforts to mitigate, but we can't stop every crisis from happening. But the good planning can help with mitigating the impact for our students and our staff. Why do we need this training? Also, because federal law includes a significant emphasis on comprehensive school safety, and that's definitely tied with this. And it's really important. Over or under responding can actually be harmful. And so equipped with this training, our teams have the ability to assess a situation and make those decisions about how to appropriately intervene. So what does PREPARE offer schools? Again, I already shared evidence-based training to meet the unique needs of schools. It is aligning with ongoing mental health and safety experts, and it aligns well with multi-tiered systems of support, where we think about what we provide for all, and then thinking about what individuals might need differently or more intensively. And it aligns well with other crisis response supports, our suicide prevention protocols, our threat assessment protocols, which I'll talk a little bit about later on too. It's also really flexible. Again, when you think about what is a crisis, it really runs on a scale. And so this works for whether it's a small or large scale event. And really, teams need to be prepared to address crisis at all levels. A minimal level of response might be that one or two students need additional support, or one or two staff members need to support, maybe even just one student. Sometimes we have a situation where we need a building level response, where our building crisis response team needs to come together to provide a certain level of support or response. We also sometimes need a district level response where the crisis is more significant and we need to bring in district level crisis response team members to support, and maybe in multiple buildings, maybe just one building. And with that, sometimes we also need regional support. We do partner with Montgomery County Intermediate Unit. They provide crisis response team members as well, so that if a district in Montgomery County needs some additional support in a situation, they can lean on Montgomery County Intermediate Unit to bring in additional trained counselors to be able to support within the community. We have taken advantage of that here in Lower Merion as well. And really, each school needs to have that crisis response team because they know their school, they know their students, they know their particular school community. So really important to be able to respond at the ground level as well. So what is the PREPARE model? This just gives you a quick snapshot. It's actually a pretty intensive training that we go through related to the PREPARE model. First, the P, prevent and prepare for crisis. Again, we want to try to prevent all crises from occurring, and so there are definitely things that we can do to be proactive, especially when we're thinking about school climate and our student behavior and thinking about prevention. The R stands for reaffirming physical health and welfare and the perception of safety and security. And this aligns with, just hierarchy of need, right? In a crisis situation, we need to first reaffirm that people feel safe, that students and staff feel safe, and make efforts to support them with feeling safe. And then it's looking at evaluating psychological trauma risk. And this is really where we start thinking about who needs additional support. Not everybody's going to respond to a crisis in the same way. And so we have to think about that crisis response team has to really think, some students and staff aren't going to need any support. Some might need some pretty extensive support. And so it's really thinking about what's that level of psychological trauma and how can we help to intervene to minimize that. And then providing those crisis interventions and responding to the mental health needs. And this is where we really do shift from the all to the individuals and really thinking about individualizing what each individual student or group of students might need. And then we really examine on the other end of that the effectiveness of what was put into place, the effectiveness of the steps that we took, and really think about how we can refine that. We're always looking to be better and learn, and we do learn each time that we go through this. We are very fortunate that we've committed to prepare. We recognize the value of having prepare training for our team members. And so Dr. Adil Naray, who's the lead supervisor of clinical services, who was with me at the meeting last week, and Ms. Terry Quinlan, who's our lead supervisor of health services and student safety, are actually certified national trainers of prepare. So they go through rigorous training that they have to keep up, and then they're able to be our direct trainers back. So not only is that cost benefit for the district, which is a positive, but it also gives them a different level of expertise. And so when we're dealing with situations, they're often at the table leading those conversations and helping teams to remember those tenets of prepare as we're working through those situations. So it's been a good benefit for the district. So prepare is actually broken into the training is into 2 workshops, and this is just to give you a sense of what's covered in the training. Workshop 1 is a 1-day training. Workshop 2 is a more intensive 2-day training. So workshop 1 is really for participants to just acquire some general knowledge and skills. to facilitate crisis preparations, to think about school climate and how some of the things that we're doing in our school can actually help to prevent and protect against crisis incidents. And then really thinking about emergency operations plans and how does that tie into this as well. And within this training, it really provides an in-depth review of those first two elements that we talked about, the prevent and reaffirm, as well as thinking about that final element of examine. And this is where we're really examining unique needs and functions of school safety and the crisis response teams. And in this training, we spend time as a team thinking about, what existing resources do we have? What are we already using? And how does that tie to prepare? How does that connect with the prevention of crisis? And we talk about school climate in particular and what impact that has across the board on students. So it's really designed, and the training itself is designed with a lot of engagement to stimulate professional thinking about ways that we can establish and sustain comprehensive school crisis preparedness protocols and to better ensure safe schools. This training in particular is really appropriate for a range of team members. For us in Lower Merion, we've identified our student services team members go through this. Our student services team members in all of our schools include our school psychologists, our school social workers, our school counselors, and our school nurses, as well as our building administrators participate in this as well. And then the second training is more intensive, and this is really for those core team members who would be facilitating the response to a crisis situation. And so this is really looking at helping them to develop the skills required to provide immediate mental health crisis interventions. And in those situations, we're thinking often about students and staff and our school community members. And at the same time, recognizing that in some crisis situations and in many, those that are responding and supporting are often also going through the trauma themselves. And so being mindful of how we support the people who are supporting others as well as we're going through this. So again, Prepare Workshop 2 is a 2-day training, so it's much more intensive, and it's responding to acute traumatic stressors in the schools. And it's really taking those teams and building skills to help them be more comfortable so that they can conduct psychological triage. It's really about evaluating the level of traumatic impact, thinking about how to respond in a multi-tiered layers of support. Again, one size fits all is not going to work most times. We've got to really think about what do individual students need and talking through with teams how to go about that. And this is really an appropriate training for any individual who's going to serve on those mental health crisis intervention response teams. And when we think about the traumatic impact of a crisis, these are the variables that come into play. Certainly predictability. If it's something that takes us completely off guard, the impact of that, the traumatic impact of that might be more significant. Certainly the duration of a crisis, how long is it lasting in length, could also have an impact on the amount of devastation caused by the crisis event. When we think about consequences and that level of consequence, within that you're thinking about what's the impact, the number of people that might be impacted by the situation, and then of course the intensity, and then perhaps the intensity of the outcome. So all of these things come together to be variables that will lead to what amount of devastation there is related to the crisis. And it also leads us to what do we need to do to help support in those situations. We use Prepare runs through all that we do. And it has a nice tie. One of the nice things about Prepare is it does recognize the importance of tying in other key mitigation strategies and supports. And so our suicide risk assessments, again, threat assessment, school safety and climate, the Prepare supports with all of that. A good example of that, in May of 2020, we updated Board Policy 245 and administrative regulations related to suicide prevention and self-harming, and we did that through a prepare lens. So we use that as a mindset as we're going into some of our work. It also ties with our threat assessment. So a suicide risk assessment is a student at risk of harming themselves. When we think about threat assessments, we also have to think about is if there is a situation where there's concern that a student might be a threat to others. And CSTAG is Comprehensive School Threat Assessment Guidelines. It is also a research-based guidelines that the district core team members are trained in and follow when threat assessments are required. It was developed by Dr. Dewey Cornell out of the University of Virginia. We've been fortunate to have one of his team members who helped develop it train us multiple times now. So that's been a great asset for the district as well, and prepare ties nicely with that. And then just see, again, the importance of that school safety and climate. Despite COVID, I would say we've still been able to get a lot in there in terms of providing training and workshops over the past 2 years. And we have done trauma-informed care. We included within that professional development on racial trauma as well, and dealing with that. We did that for all staff. Our suicide awareness and prevention. The state actually requires a certain level of training for secondary teachers. So in teachers in grades 6 to 12 are required to have a certain number of hours every 5 years in suicide awareness and prevention. We actually well exceed that. We believe that our teachers K to 12 need that knowledge base and skill set to be able to see the warning signs and to know how to intervene or how to support students in those situations. And so we provide that to all of our staff for students K to 12. We've offered health and wellness sessions for our staff. And at the beginning of this year, in partnership also with our Human Resources Department, we put together like a mental health wellness guide for teachers, and included a lot of one-pagers. What are the core principles of trauma informed on one page? It kind of summarized some of the training that we had done over the past 2 years. How do you respond when you see the microaggressions and bias? How do you respond to those situations? Really look-fors, a one-pager of a look-fors for suicidal ideation. So in one place, our teachers and staff have a really nice summary of the different trainings that we've provided in these areas. And we also, our student services team members, have offered trainings to parents and guardians as well. And as you see, we really have a strong commitment to this. We believe strongly in the value and the importance of this. And I can say from using it, I see the positive benefit that Prepare has had for the district. And we are continuing with ongoing training and staff development. With the training for Prepare in particular, that did get slowed a little bit by COVID, but we're moving right back into it. And again, having our in-house national certified trainers is a big help with that in terms of not just providing training, but being leads in the conversation. We have a development of our crisis response teams. Again, we have crisis response teams at the school level, and we also have district level team members who are trained also to support in crisis response. And again, we use it as a lens in all that we do. So as we're working through refinements to our emergency operations plan, as we're looking at board policy, when we were developing the district health and safety plan through the COVID situation, we had Prepare as a mindset as we were going through. So we really do see the value of this. We see it tied through all that we do. And questions. And thank you for the opportunity to share.
Thank you very much, Ms. Fraser. I'll open up to the board if you have any questions. Ms. Kayla.
I'll warm it up before Carrie gets her opportunity. So I thought that was a fantastic presentation. It's a really outstanding program, and I know you've done a lot of great work with it, you and our district-wide team. One thing that I thought was really helpful when we talked about this in CCOB was you sort of gave examples of what a crisis could be to kind of get at the breadth of the application. So from an individual level to a school-wide level to a community level to a global level. If you could sort of give some generic examples so that the public could really understand that, that'd be really helpful. Thank you.
Yeah, so it could be, again, very individualized. We might have a student who has something expected happen in their family dynamics, and that impacts them in school. So if there's a change in their family dynamics that impact them, even moving to a new school could be impactful. Weather events can be crisis. If we think back to the time when we got the snow and students were on buses for a long time and thinking through how we respond to that. And then larger scale, of course, when you're dealing with, possibly maybe the death of a school community member as well. So it really ranges.
Great, thank you.
Yeah.
Ms. Sotner?
Sorry, I feel bad because here's my second list of 18 questions for you.
okay.
But it's just really interesting and I want to unpack it even more. So you gave that great example of you don't always know a crisis is going on because even though the student comes to school, you don't always see the crisis as school personnel. So does everybody get trained in this, from the teachers to the aides, to be able to recognize those signs?
They do, yes. So the prepare itself, no, not all staff get trained in the prepare. This is really for your team members who are going to be leading the crisis prevention and response. But this is why it's important to show how it ties to trauma-informed practices, how it ties to social-emotional learning and the things that we're doing. It ties to responsive classroom. It ties to restorative practices. That idea of relationship building and community building is all tied together. All staff are getting that training. The trauma-informed practices, including the racial trauma, the suicide prevention and awareness, all staff get that.
Got it. So would you say then prepared is a strategy model for the organizational structure and then all these pieces fit under it as Maslow's lower level, here's the base factors we have to cover, everybody, but this is if something goes wrong on a larger scale, then this is how the strategy works?
I think it runs through it,
okay.
Right? I think it weaves through all that we do. So when you think about, in addition to, sure, when we're responding to the crisis, how do we make sure everybody has what they need? But even, again, tying it when we think about our school safety protocols that we have in place, the emergency operations plan is a good example of that. Again, your second step, the programs that we're using, responsive classroom, all tie nicely, and I think that is part of that. They build, right, and that's part of that prevention piece.
Is there a place where parents, community members can kind of go and dig into it a little bit more? Because it does at times sound a little nebulous. Because even though it has the lovely acronym, you want to know exactly what that looks like. I'm sure it's a paid program and all the trainings and all that. But is there a site we can dig into it more?
Yeah, you can Google it and find it's the National Association of School Psychologists. And if you type in prepare as you see it spelled, it will come up. They do have a brochure that's meant to be public facing, so that may be helpful. It's certainly something that we could put a link to on the website under student services.
Yeah, to try to unpack it a little. When thinking through, there is a crisis, there is a trauma. Are your FBAs brought in? How do you, when you're looking at the long-term impact and saying how do we actually mitigate this crisis in a longer-term sense? Do you have different support staff, aides and other people coming in to kind of help you walk through the process? How does it kind of range after the event?
Yeah, it depends on what's needed. That's where that piece of the tiered systems of support come into play, right? Because some individuals, some groups, maybe will just move forward and it's better to go towards normalcy. And then other students may need higher levels of support. They may need behavioral supports. They may need counseling supports as a result of that, supports through our school social workers and our psychologists. So that's, yes, we are very fortunate that we have a wealth of resources within student services to be able to provide that.
Cool. I think I have just two more questions. One, how often does the staff get trained to be like certified? Is there like a classic certification for the, not just the experts that you have on slide 9, I think, but like all of the staff? Is it a yearly training, again, COVID aside, or every 2 years?
Yes, so 2 layers to that. So the prepare training itself for student services team members and administrators, in our ideal, that would be that all team members are trained, workshop 1, workshop 2, so the 3 full days of training, and then refresher trainings annually. That's what our goal is. Again, COVID did disrupt that a little bit. The same with our threat assessment training, we prioritize that as well, and wanting all team members thoroughly trained, and then refresher trainings every year. It's really important to come back to the table and continually think through and talk through the strategies and have those team dialogues. When we do those trainings, we purposely have building crisis response teams together, because it's about thinking about what do we have in our school, what's unique about individual schools, and how as a team that team is engaging. So it's important.
Great, so that's happening, I'm sure, with the new middle school and like all of the work being done is prepared. So they're almost like on a different track with that, correct?
Yeah, I mean, yes, the intention will be for that training. I mean, the one thing I would share, though, is that with the new school, we have a lot of staff who are being transitioned to the new school and staff who have already received training.
But they'll have to apply it to a new setting, right?
Correct.
So
Yeah,
last question.
correct. That's where like those refresher trainings and
Yeah.
working together as a team is important.
And reassess kind of when I think of crisis, and you're never in isolation, you're always dealing with outside agencies that are there to help, but aren't, which is I think the biggest selling point to this to me, is that it's teacher and education written, driven, and experimented and tested. Those outside agencies aren't educators. And again, they're only there to do well, but they have separate training on how they're supposed to handle the situations. How do you cross it over with like fire and police to ensure that when they're walking into your system, they know how to support your system and the kids?
Yeah, it's about that communication, and again, that importance of not waiting until the crisis happens, right? So we do have a strong partnership with the Lower Merion Police Department, and by extension, emergency responders, and have included them in some of the training that we've done, so they also can understand how we handle crisis situations. So it really is about that the communication that takes place with another good example of that, like communication you do before the crisis happens. There is a meeting that we have every 2 weeks. It was initially initiated by Lower Merion Police Department, but it is representatives of community organizations, including the district. And it is like Lower Merion Counseling and Women's Center and different agencies that support within our community. And it's a way for us all to come together and talk about what resources are available. Are there families that we're all supporting, and how can we help kind of navigate those supports and really help families that are in crisis. And so some of that work of building those relationships with other community members outside of crisis has been critical.
Great, thank you. And this is not a question, more of a statement. There's a lot that falls under student services, because you are up here like every single meeting, and I just wanted to thank you and recognize that as well, because you do a lot. Thanks.
Thank you. Thank you. I have a great team. It's a great team.
Mr. Moore?
Well, I just want to, I mentioned this at CCOB, and one, just thank you for the really comprehensive, report. And one of the things I think that's just really critical in this, and that I appreciate about it, is that it's not only looking at how you're dealing with crisis, but also really focusing on school climate and how those crises may impact students. And so just making sure that, for instances where there may be police called, and how students are impacted by those crisis moments beyond that incident, right? But that there is the follow-up and that there is the multi-level interventions, and so that we're engaging with parents and we're engaging in community as well as it relates to how students are managing and dealing with these situations.
Yeah, and what's great about putting these supports in place is it helps to minimize the amount of times that you may need to bring in outside, because we've developed the systems internally to be able to support.
Thank you. Any other? Ms. Schaffmeister?
I think I just echo my, not collaborators, well, on this program. I do have, and thank you for getting some of my questions answered already. I'm wondering about, you mentioned there's like, you can't react over and under, and that seems like such a subjective or kind of, I think, how do you do that?
That's where it's so important to be with the team that knows the students, right? Whenever we have a situation, even when district crisis response team has to help support, it's about talking with the team members that are in that school every day, who know the students, who know their colleagues, and really that level of knowledge of students really helps with determining that level of response and really leaning on that.
Yeah, because I see this, like you're talking about looking at it through the lens and that, and it's kind of like, it's still kind of go back that it's more of a reactive thing, and I see there are pieces coming through that it's more of a proactive, but on a deal, because the teachers and the aides are the front line working with the kids on a daily basis, and they're the ones that can mitigate a situation or escalate it. And I'm wondering, how do we get that working together? How do we, because I mean, like, some of the programs we have are about teachers learning about this program and then just telling the kids about it. But I want to see the teachers and how they're trained to be able to work with the kids, especially when we're looking through the lens of kids that have cognitive, social, and behavioral disabilities. I mean, those are the areas where I think you get a lot of, some of them are undiagnosed, but you need to know how to react.
Yeah.
And how are we doing that?
Yeah, so excellent, and I feel like we can always do more with that, right? So excellent question. That goes back to some of that training we've provided to all staff, that trauma-informed. And how do you approach, that's just about approaching the situation, right? And reframing how we look at it. And that's at the classroom level, right? It shifts from, and this is what we've trained our staff in, you're shifting from looking at what's wrong with the child to what's happening to the child, and really coming at it from a lens of being curious and trying to understand that child and what's happening, as opposed to judgmental. And that training is provided to staff, and I agree with you, we always can keep learning and growing in that area, and you're right, our teachers and our aides are on the front line of that.
Okay, yeah, because I'd like to see that training really stepped up,
Yeah.
especially as we're going in right now. We also are going to see an incidence where the state is not funding early education, not early education, early intervention services. And so we're going to have kids coming in that haven't had the services and are behind it and going to have some behavioral and social issues. So I think that actually answered my questions. Go ahead. Okay, thank you.
Thank you.
Thank you. So I'll sort of wrap up. So I think it's interesting because it's prepare, and it's sort of a lot of things, but it's that first P, right? That should be bigger than all the other Ps, and though they're all capitalized, because that prevention is such an important piece to everything. And it ties in with all of the different trainings. And I just want to acknowledge and thank you in terms of all the different trainings. So there's training around this, and there's training for restorative practices, and there's training for trauma-informed. And it's finding the time and the ability to do all that training, I think, is a lot of work, and there's a lot of scheduling, sure, but just being able to get all of that, and especially with sort of this delay from COVID when that wasn't possible, right? So I just want to acknowledge that it does unfortunately kind of take time sometimes to get all of those different pieces done. And especially around, switching curriculum and things like that. There's just so much training that we provide our staff and teachers and everyone, but also there's always more that can be done and finding that balance. I did want to ask, talking about training, about the parent training and what that looks like and what opportunities there are for that.
Yeah, so we've provided over the years, so we've offered some student services evening sessions. Our school social workers have offered parent sessions, again, facilitated by student services. So those are typically posted and we share that information. We've partnered with ISC to provide the parent training series, and that's offered a lot of different topics with families.
Thank you very much.
Good. Thank you.
Okay, so we will move on with our agenda. Next on the agenda is additional agenda items. I just want to note that there are none today, so we'll keep moving. And so next we come to audience recognition. At this time, Mrs. LaPera will open the chat feature, and you'll see a 10-minute timer appear on your screen for those of you watching on Zoom. You can submit your comments and/or questions via the chat feature. Please be sure to begin with your full name and where you reside within the district, which can just be a neighborhood. It doesn't need to be specific, but that's very important in order for your comment to be shared. Ms. LaPera, do we have any in-person comments for tonight's meeting?
Yes, we do. We'll start with Abigail Rubin, followed by Dina Yaski, and then Danielle Joyce. I'm sorry, if you're new to this, you can come up to the podium when you start. You can please tell me your name and where you reside within the district, just the town, please.
Sure. My name is Abigail Rubin, and we live in Ballackinwood. So, hi, board members. My name is Abigail Rubin, and I'm the parent of a current afternoon kindergartner, which is why I'm here. I'm also the parent of 2 younger siblings of hers and also another one imminently coming by. We live in Ballackinwood. We are so lucky to live where we do because we walk to school. Go Owls, we love it there. And it's been a great experience. But I'm here because full-day kindergarten is long overdue. And I appreciate what Dr. Mumin said in the beginning of the meeting. It's great to hear that this is really on the forefront of everybody's minds. And it's been a long time coming. I put out a petition with the help of many of the parents here wearing red, maroon. We're parents of young children. First clean thing that was in the right color came on. So we're here to really share our support, and we want to work collaboratively because we are so passionate about this. I'm a stay-at-home parent, and I can tell you that afternoon kindergarten doesn't work for anybody's schedule. Playdates aren't happening the way they used to. So many of these children have been have to make up for so much lost time these past 2 years especially. Many parents are able and lucky to be able to provide preschool to their children prior to kindergarten exposure. Even with that, during COVID, there was no preschool exposure. So this is about 2 years of lost socialization, emotional development, and the like. So this is super crucial at this point especially. And we feel that right now the district is really well positioned with the new middle school being built, the shift from 5th to the middle schools as well. We'll open up some spaces, and we just really want to make this happen. So I'm here to kind of lend my voice to that. We have a petition with over 500 signatures of residents and other parents who agree. I've spoken to people from peers of mine with kids in the same age group to neighbors of mine who've lived on our street for 40 plus years who have said, we've been talking about this forever and it's time. So I appreciate your consideration and attention to this, and we look forward to making this happen in the next 2 years. That's what our hope is. Thank you.
Thank you very much.
Dina Yaski, Danielle Joyce, and then Ruth Jenkin.
Good evening. I'm Dina Yaski, and I live in Wynwood. And tonight I'm speaking as a resident, a parent, a fellow educator, and an alumni of the Lower Merion School District in support of full-day kindergarten in our district. So over 35 years ago, I attended half-day kindergarten at Penn Valley Elementary School. Times and expectations of our children and our schools have, of course, changed since then. And today, schools are tasked with providing solutions and keeping pace with developing needs of our community and the larger world around us. I think we heard a very in-depth presentation of just one smidgen of the things schools are tasked with taking care of. But in providing those solutions and keeping pace with those needs, full-day kindergarten has become the norm. 75% of districts across the country provide full-day K, and 85% in the state of Pennsylvania do so as well. But sadly, Lower Merion has failed to evolve in kind and meet the needs of many of our youngest students and families for some time now. In our jewel of a school district, which I really do believe we have, with exceptional resources, teachers, and staff who produce such high-quality outcomes, it seems amazing to me that this body would be content with performing in the bottom 15th percentile in any metric for so long. While the board and administration may have been content with this position, I don't think that your constituents and members of this community are any longer, and we would like equitable access to full-day kindergarten. As educators and stewards of education yourself, I'm sure that you are already aware of the research-based and scientifically evident benefits of full-day kindergarten, from closing achievement gaps and inequities in education, and even as cost reduction strategies, saving money on retention and remediation services over the long term. We would like to see full-day kindergarten happen by September of 2023. As Abigail mentioned, we do have a petition signed by more than 500 residents and feel that the building of Black Rock Middle School has created space in each elementary school that was not available before. And we, your community, feel that we deserve a say in its usage. We now have more space, and it's a matter of priority what we plan to do with it, and full day K is our top priority. Thank you.
Thank you, Ms. Yaski.
Danielle, thank you.
Hi, good evening. Danielle Joyce, Villanova North Side, so Lower Merion side. I'll keep this brief, trying to come at this from different lenses. My lens is through that of a working mother. My family, we actually moved here this past summer. I am a third-generation native Floridian, and one of the big reasons we came from Florida was because of schools, and came specifically to Lower Merion. At that time, I honestly didn't know half-day kindergarten existed in this day and age. It hasn't existed in Florida since the 70s. So that was a bit of a shock to me, coming from that background. So really, as you know, when we look to why did we start full-day kindergarten 40, 50 years ago across the nation, was really to accommodate working parents and their schedules as schedules changed. And then once I started looking, just what would this cost our family as we continue down this journey? Just looking at our Right at Home or Right at School program to do the wraparound care as well as the extended kinder cost about $1,300, which is about what I'm paying already for full day Montessori education. So once I started digesting that, I said, we can't attend the schools as they were intended for us. Like, we just can't do that. So really, that's the lens I'm coming at this from. So just to have a different perspective. Thank you, and I do appreciate you addressing this up front, so.
Thank you very much, Ms. Joyce.
We have Ruth Jenkins, then Marissa Prelak, and Jasha Rubin.
Okay, we got them together. It's a familiar topic. I've been here for 30 years talking about this. Dina lives across the street from me. She was 5 years old, my little neighbor. Now she's a mother and an educator herself. I just think that we have spent so much energy on the equity issue here, developing a mandate. And now we have a mandate for a kindergarten, and it's also an equity issue. These are students that are not are entering first grade without a kindergarten experience, without knowing their colors or their letters or how to write their name. And it is as we mentioned, an achievement gap that won't close if these students are not in kindergarten. The other full-day kindergarten also has to do with the working mothers, and it's definitely a prejudice against working mothers who cannot afford $15,000 a year to put their students in private kindergarten. So they are at babysitters, and they come to school less prepared than other students. I even feel pre-kindergarten is an essential part of this program. But as mentioned before, we are in the 15th percentile of education when it comes to full-day kindergarten. I really believe in a kindergarten center, but I know that that may be something that we have to look to in the future. I also wanted to say something about the security issue at Lower Merion High School. The students, I have been tracking the students and photographing some of the students as they come out to change their cars during the day. If something happens to those students, if they hurt themselves, if they're in an accident during any of the time that they're supposed to be in the building, if any of them decides that they're having a crisis and they want to bring a gun into the school is wide open. It is not a secure facility, and I can qualify that with documents. So if we're looking for safety, we need to put kids in full-day kindergarten, and if we're looking for safety, we need to close Lower Merion as a safe high school. Thank you.
Thank you, Ms. Jenkins.
Marisa, then Yashka Rubin, Allison Barron, sorry.
Hello, my name is Marissa Prelak. I am a mother, a parent of a, what?
Your town, where you reside,
Yes, I live in Bala-Kinwood on Kent Road, near Kinwood. I'm a parent of a Kinwood first grader and a kindergartner, a morning kindergartner, and I have another daughter who will be entering, I guess, in 2024. I also am a pediatric neurologist in the community, and I just want to jump on the great things that my peers have said here and echo that in 2023 in the fall, those will be kids that were 2 at the start of the pandemic, and to focus on socialization, they really had a very limited version of socialization, which I think is a really fundamental part of kindergarten and a building block of confidence. And especially as a working mom, it's very difficult to provide consistent socialization for your kids that you're not with and who don't have a consistent place to go from day to day for a full day. So just to echo the importance and hope that we can all work together and collaborate to make this happen. Thank you for listening to us.
Thank you very much, Dr. Prelak.
Thank you. My name is Dr. Yasha Rubin. I'm from Bala-Kinwood, and I want to echo the sentiments. I appreciate, Dr. Merman, you addressing the issue in advance of the meeting. I'm here in support of full-day kindergarten, and I know that many of you on the board have also, in the past, dating back years, have supported this, and I want the initiative to move forward. I know that's been somewhat stagnant, and for all the reasons we talked about, but I find it difficult to believe that in a place like Lower Merion with the space and money that we have, that we can't be within the 85% of the rest of the state that is now with full-day kindergarten. And I think about my wife and who you met, Abby, and my kids, and the rest of the working mothers and parents who struggle to find alternatives if there isn't a full-day option. So I appreciate your time. Thank you very much.
Thank you very much, Dr. Rubin.
Allison Barron, and then Yair Let.
Hi, everyone. I am from Narberth. My name's Allison Barron. My husband and I moved here only a year ago, and we actually moved from the city, narrowed down our house hunt to Lower Merion District. I was devastated when I found out a few months into living here that there was not full-day kindergarten. To be honest, maybe this was naive of me. I didn't even know that was such a thing. I was like, is that legal? I understand the reasons, you know, there's space issues, but everyone has sort of brought up some great reasons as to why now is a great time. I'll keep this brief. The two things I'm really passionate about are parenting and gender equality. And I study psychology. I'm a professor of psychology at Temple University. I can provide a huge long list of resources as to why working moms, stay-at-home moms are the ones who are suffering when there's not full-day kindergarten. It's already, I mean, just the fact that this nation doesn't have any supplement for preschool really is a whole nother story. But this is something that I think you can see we're all very, very passionate about, and just especially the women. You know, there's still pay gap. There's still inequality for moms. And, you know, it's been a tough couple of years with the pandemic, and it would be just such a great thing. I think everyone agrees. Just look at how many more women there are here. Thank you very much.
Thank you, Dr. Baird.
Superintendent and board members, my name is Yair.
Sorry, so you have to say that at the podium and your name and where you reside.
My name is Yair, and I live in Marion Station, and my message is going to be relatively quick. I'm going to start with an introduction because it's very relevant. My wife, myself, and the kids moved here in the last year or so. And the reason that we moved to this area was because of the wonderful community and the wonderful schools. That's why we moved here. And since we got here, our most important goal was to integrate ourselves immediately into the community. And we did. We basically became board members of the Marion Park Civic Association. My wife opened her pediatric dental practice here in Narberth. We're friends of the Commissioner Gilda Kramer, and she actually hosted us to several shows. We really feel that we know the community. And all of this to say is that we feel that we know a lot of the parents here, hundreds of parents, especially through my wife's work. And I've never seen in my career or my life such a wide and strong consensus. I've never seen anything like this, that hundreds of patients, sorry, I just came from the hospital, hundreds of parents basically feel so strongly about one thing. And it's not only about the 500 people who signed the petition. It's hundreds and thousands more of people, of parents and parents-to-be from all over this area who feel the same thing, 100% of the people. So much so that the problem is not only in the last months, it's not in the last few months, it's not in the last few years, it's decades. And you guys mentioned it. I think I forget her name, but she mentioned that 30 years ago, 40 years ago, Commissioner Kramer told me that her kids, she really wanted to take them to public, but she wasn't able to, and she had to pay to Montessori or whatever it is, because it was only 3 hours a day. The consensus says that we have to move forward. And I gotta tell you an example, and this is very important. I work in leadership of a big hospital. Just today we had a meeting, and it's a very rare meeting, when the enterprise comes with a decision and there's strong opposition or consensus amongst all the physicians, they take it back. This was a meeting today at 4 p.m. We took it back to administration. We said, no, this is how it's going to be. 1 more minute left. So I'm going to get to the point. I think that there's no need. You've heard so much about why we want to do this. And we know for 30 years, 40 years, well, we can do it. The space, the money, the recruitment of teachers, all of this, we know this. But it doesn't matter. We elected this board, and many more board members throughout the decades have run on the premise that they're going to do this, and they're going to become the first one who's actually going to execute this full day of kindergarten. And yet has not happened. Our expectation, it's not a request, our expectation is that this will happen no later than September of 2023. We are here to support you and work and brainstorm, whatever, but this is the expectation, September 2023, ideally even before that. We feel very strongly about it. Thousands of people who are living in this district. Thank you, Superintendent and Board.
Thank you very much.
Ms. Gesser?
Thank you. My name is Neela Gesser, and I live in Bala-Cynwyd. I have 2 daughters, neither of whom was able to benefit from a full-day kindergarten. I'm a researcher, and I specialize in criminal justice and psychology. And I'm here to tell you something that I assume you probably know, which is there is solid evidence, solid scientific studies, one after another, that show that the impact of full-day kindergarten lasts all the way through at least middle school. And the absence of full-day kindergarten creates gaps that also are never closed. And they also last till at least middle school. As you heard before, there's also solid evidence that when there is not a full-day kindergarten, one of the parents has to stay home if they can't afford some paid for care, and that is usually the mother who gives up her job, and the pandemic has made these things a lot worse. I find it kind of shocking that the city of Philadelphia, and we all know the state of education in the city, does have a full-day kindergarten, and Lower Merion School District does not. And I believe that changing that could turn the school from being a good district to a truly great district. Thank you.
Thank you very much, Ms. Gesser.
That's it for the in-person comments.
Thank you. Ms. Buckman, can you now please read the comments through chat?
Sure. The following comments were submitted through the chat feature on Zoom. The first one is from Andrew Puckle of Wynwood. Andrew says, our students need access to full-day kindergarten in order to start on the right track for their education. In light of the pandemic, this age group needs more time practicing social emotional skills that will prepare them for a successful school career and a meaningful life. Lower Merion has ample resources, and the board and staff should be able to make this happen in September of 2022. Thank you. The next comment is from Colleen Campbell of Ballackinwood. We support the need for full-day kindergarten. Access to full-day kindergarten is critical for the development of our students and enhances access for all students, including those whose guardians work full-time. I welcome the opportunity to engage in this space going forward. The next comment is from Mariam Vinci of Ballackinwood. I have 2 children currently at Kinwood Elementary and 2 younger children as well who will attend the district. I wanted to express my support for full-day kindergarten and ask the board if we can understand what the hurdles are to full-day kindergarten and how we can work together to resolve them to ensure full-day kindergarten by fall of 2023. It's time to catch up and give our children the same right as most other children in our state. Thank you for your time. The next comment is from Alexandra O'Neill of Wynwood. Thank you for allowing the chat feature for questions for the evening board meetings. I am requesting that you re-enable that feature for the committee meetings. I am also requesting that you record the committee meetings to increase accessibility to those conversations. There are many people who want to be able to participate either by listening and asking questions via chat or by viewing the recording later and following up with questions, and not all of those people can make meetings that happen at 8:30 a.m. on weekdays. Thank you. The next comment is from Dr. Pam McDonald of Wynwood. I have a student in AM kindergarten at Penn Valley and have a younger child as well. I wanted to express my support for full-day kindergarten. I saw a huge difference with my daughter when she was able to join full-day K in December. I am a pediatric neurologist, and the developmental differences I noticed were great. There are many nearby school districts that have made full-day kindergarten work, and I hope we can do the same thing. I look forward to working with the district to make this happen, hopefully by fall 2023. The next comment is from Kate Trombello of Ardmore. Hello, school board. Thank you for all you have done the last 2 years to keep our children healthy. I'm a parent of 3 elementary schoolers and am asking you to relax the restrictions on parents volunteering in the classroom. Most school districts in the area have relaxed these measures and are back to full parental participation. With low COVID cases and high vaccination rates, I believe it's time for Lmsd to do so too. I'm sure you know there is a mountain of evidence that shows parents being active in their children's schooling, both in and out of school, gives better schooling outcomes. It also increases staff morale, facilitates better relationships with parents and educators, and helps children have higher self-esteem. Students are now unmasked, having whole grade assemblies, and parents can attend the Junior Olympics, indoor sporting events, and musical events. The policy is inconsistent with other current policies, and I'm hopeful you'll allow parents back into the classroom. And that is the conclusion of the comments in the chat.
Thank you very much, Ms. Buckman.
First and foremost, thank you so much for sharing your comments this evening and your support for full-day kindergarten. I just want to reiterate, again, next week, we're going to do a full presentation to address some of the concerns that we've been talking about, to talk about some of the historical information that we gathered over the years in regards to the importance of full-day kindergarten and where we are today. That presentation, please anticipate that presentation will speak to some of the new issues that we're dealing with or concerns, advantages that are presently upon us. With the 5 to 8 grade configuration, we'll be able to speak with more authenticity in regards to open classroom spots and in which schools. We'll be able to have a conversation around projected cost in regards to personnel. And I believe in, and I'm not sure about how this was done historically, but I believe that there's a lot of value in bringing that piece of the equation into the forefront, looking at the cost. Also, we have to take a look at our K+ program. There have been presentations this school year around K+, but how that also impacts our full-day kindergarten and some updates there, which we had an update at a meeting a couple of months ago. From that point forward, this is where we'll start to establish the comprehensive plan around full-day kindergarten, which will include engagement activities, which is surveys, engagement activities with constituents, parents, community members like yourself, so that we can be able to put this information, map it onto our current demographic study, and try to make sense of the numbers as they are and the projections for the future. I also anticipate that this engagement activity, we're going to have to look at surveying and engaging our parents who are choosing other private entities for kindergarten services, engage, where they are and would they come back to the district, and how we are a community. We are a community of educational stakeholders. We don't want to get into a competing force with none of our private vendors, but as we're hearing this evening, there is perhaps a need for us to have full-day kindergarten for our parents and constituents that aren't able to access those other resources. So again, this is the beginning or the premonition of a journey where we're going to flesh this out and look at it. In regards to a timeline, we'll be able to start talking about a timeline as we start to get into these engagement activities. One of the things that, again, and I keep going back on this point, space is one thing to have in a district, and it's easy to say we could just move programs in place, but there's curriculum that has to be put in place. There's human capital, meaning personnel, that has to be put in place. We have to talk about safety and how we deal with our kindergarten students. We have to talk about transportation. We have to talk about cost. And one of the things in which was mentioned, which is a very point well taken, in regards to districts like Philadelphia, we have to look at our funding structures too. That's one of the pieces of the arguments around fair funding in the Commonwealth of Pennsylvania. We're complete contrasting. We have a complete contrasting budgetary structure, whereas City of Philadelphia is mostly funded by state dollars and federal dollars. Small percentage is federal, but mostly state dollars and local contribution. $2 billion budget. Lower Merion School District is funded by taxpayers. Limited state, limited federal. So again, so I want to address, and this is just for public consumption, this is not, we don't have an unlimited bank account when it comes to funding. Right? So we will bring the funding pieces into the forefront and say, this is what it looks like, because the burden, the funding burdens at times will fall, more than likely fall on the taxpayers. So we have to be very, very judicious in how we scrutinize those dollars, but we'll be very intentional and transparent in how we put that out there. So I'm saying that to say that we're going to have a full comprehensive look at full-day kindergarten. And of course, we're going to address the positives. And there was a comment, I love the fact and my heart, I have a soft spot for pediatric physicians and nurses, because it was said here tonight, we know when we're talking about achievement gap data, there's one area when we're talking about, it's kindergarten. Then there's another checkpoint when we're talking about third grade. But the true achievement gap begins with prenatal care. And so that's a whole nother discussion. I don't believe will come up in this kindergarten discussion, but I like to say again, and I wanted to make sure that I led the comments on this, that we are, as an administration and as a school board, really looking at this issue with some intensity. And we'll be very public with how we're approaching this. And again, we have to be great stewards of our dollars too. So we will be very public about that also. So again, thank you again for your comments this evening and your patience as we talk about this and saying, oh, we'll be back next week with a presentation. Yes, we will. And we'll continue to build on this and try to work our way into a projected timeline in the near future. One comment that was online, the expectation of fall 2022, I would not be authentic and say, yeah, we could do, that will not happen. That will not happen in the fall 22. And as you know, and it was mentioned very eloquently this evening, when we put our fingerprints on something here in Lower Merion School District, we just don't do it for the sake of doing it. We want to do it right, so it can be effective and sustainable. So we're going to do our due diligence and take our time through this process, but we will keep everyone abreast of what's going on. It won't be done in the dark. Thank you so much. And thank you again for being here this evening.
Thank you very much. I just wanted to add one request, I guess. The comment around parent volunteers in the schools, I just wanted to ask if the health and safety plan, when they meet next time, if that can be, have a conversation around that.
Absolutely.
Right.
Point taken. Thank you.
Okay, thank you very much. So we don't have any recommended actions tonight. This is our education meeting, which is not a board business meeting. So just to let you know, some upcoming board meetings, they are in person here in the district administration office boardroom unless otherwise noted. April 20th is an upcoming finance committee meeting on the student services budget review. It'll be 8:30 a.m. On April 21st is which is Thursday, is the Facilities and Purchasing Committee meeting, again here in this room at 8:30 a.m. Next Monday night, April 25th, is our regular business board meeting, also at 8 p.m., and also the presentation around full-day kindergarten. Next Wednesday, April 27th, is the next in the series of finance meetings. That one is on staffing and the IT budget review, 8:30 a.m. here. And finally, next Wednesday, April 27th, will be the ad hoc Committee for Equity and Anti-Racism meeting, which will be held via Zoom at 7 p.m. I also always like to add in some upcoming sort of district-wide events. If you're interested in theater, our Harriton Theater Company has their one acts coming up this weekend at Harriton High School. I highly recommend them. And also the following weekend, the Lower Merion Players will be presenting Godspell, and I recommend that as well. This coming Sunday is the Ask the Superintendent meeting at 2 p.m. in person at the Lower Merion Academy building, which for those that don't know, it's the building it's sort of the old historic little schoolhouse building next to Bala Cynwyd Middle School. And next Tuesday is the Interschool Council and Health Services Joint Parent Education Series, Sleep in School-Aged Children. It's at 7 p.m. via Zoom. You can get information about all of those things in your HSA newsletters and on the website. And with all of that, thank you very much for coming tonight, and we will see you next week. And the meeting is adjourned.